Thank you, Mr. Mountain. I call Ruth Maguire. Ms Maguire is the last speaker in the open debate.
Presiding Officer, I want to begin by acknowledging the incredible efforts of our NHS and care staff who continue to be on the front line, caring for patients with COVID-19 and working to prevent further spread in hospitals and care homes. Like others in the chamber, this debate is not an abstract one for me. I have family and friends doing these crucial jobs, and I'm hugely grateful to them for all they do under really difficult circumstances. Currently, estimates from the Care Inspectorate are that over 53,000 staff work in care homes for adults compared to over 71,000 staff working in care at home. As we've heard, weekly testing is offered to all care home staff regardless of whether they have symptoms or if there's an ongoing outbreak in their care home. The Scottish Government has implemented routine testing for healthcare workers where the evidence says it is appropriate to do so, but there are social care staff who currently cannot access routine testing. They include staff providing care at home, supporting living and housing support service, staff providing palliative care, staff providing support and care for children and young people, staff supporting people with no homes or dealing with addiction issues, and staff providing respite services and day services, although obviously not all these services are on at the moment. The safety of these workers, as well as of those who are in their care, must be paramount. It is important to acknowledge, as the briefing from CCPS does, that third sector providers have kept infection rates to a minimum from March through to the end of August without routine testing, through careful risk assessment and use of infection prevention control. Routine testing is important, but it is important to say it's only part of the picture. I do understand and I support the calls for it. It intuitively feels like the right thing to do, but it absolutely must be led by evidence. It's really important to remember that testing provides a single point-in-time assessment of whether someone has the virus. It does not mean they won't go on to develop the virus. Briefly, yeah.
Alison Johnson.
The Scottish Government's own testing strategy and nosocomial review group have recognised the importance of routine testing for healthcare workers. So I don't see why there's still this question about prioritisation of certain staff groups over others. Is it not long past time that we just immediately got on with this, introduced it as a matter of urgency?
Ruth Maguire.
I think Alison Johnston's consistently made these points in her speech and in chamber before, and she's done it again. I think it's also really important to note that some staff who are eligible for a test are also declining to take up the test, and they can't be forced to take a test. Presiding Officer, in the short time that I have, I'd also want to talk briefly about the barrier that losing income can place on people and affect how they choose to act if indeed it is a choice for low-paid workers. I welcome that the Scottish Government has established a social care staff support fund to ensure that care workers who test positive for COVID-19 will receive sick pay above the current statutory level of $95.85 a week, which should help in some way to ease the financial burden having to isolate places on them. It's absolutely crucial that employers also act responsibly and fulfil their duties with regards to health and safety of their staff, and that workers are actively encouraged to follow guidance and not pressured into coming into work. I have had cases where this has not happened right away, and I would urge workers to know their rights and speak up where they feel things are not right, and reiterate that employers must fulfil their duties and not put staff in harm's way. Presiding Officer, I support evidence-led routine testing for all our health and social care staff.